morning, and thank you very much for joining us. I am Yori Folarin with Asukwo James.
Good morning, Yori.
Indeed, thank you very much. But beyond me, it's them out there. Anyway, here we are, today is the 30th, and we're moving, as it were, towards the 4th of May. And that's when, there's going to be a sort of, a relaxation, of the lockdown. And indeed, Governor Sanwo-Olu of Lagos State, and we're talking about Lagos State today because one, it's the one with the largest numbers, very, very worrying. If you look at, if you just take the big three, that's Lagos, Abuja, Federal Capital, and Kano. And in the case of Lagos, Lagos is actually what? Lagos has something like almost 5.5 times as much the number of Abuja, and something like almost 7 times the numbers in Kano. And we're talking about 931 cases in Lagos, what they call lab confirmed cases, and then active cases 717. And then for Abuja, the figure is 174 lab confirmed cases, and the active cases there is 135. And in Kano, 139 lab confirmed cases, the active cases being 136. The unfortunate deaths, Lagos again leads by far. 21 deaths, in Lagos so far, total. In Abuja, 3, and in Kano, 3. Now, there's a worry. Of course, everybody has lockdown fatigue, and so there's a worry. And the president indeed has, said that there shall be a systemized, phased, opening up. People are concerned that with numbers jumping the way they are, they're not coming down, and here we are needing to open up. We're just going to be looking at what the projections are. What can happen?
I think everybody should be worried. One, we are looking at facing the virus as well as hunger, and also the government is also looking at the economy as well. They are looking at the economy, and don't forget Nigeria is more about private sector driven economy.
Yes.
And most, if not close to 80%, 70 to 80% of those who are working in Lagos are private owners.
Yes.
As in those that is the informal sector.
We know these are very important matters that you're bringing up.
We know, but
the figures are scary. In fact, we have the Lagos State Commissioner for Health, Professor Akin Abayomi, on Skype. Good morning, Mr. Commissioner.
Hello.
Hello. Good morning, Mr. Commissioner. Can you hear us, Professor Abayomi?
Your sound is very bad.
Okay, we're going to fix that. We're going to fix that. We'll get a pair of earbuds and we'll sort that out. But in the meantime, while they're fixing the prof up, I think we knew the prof needs a pair of earbuds, and that will be cleaned up. I understand everything you said. No doubt the presidency has also understood everything you said. The people of Lagos, you could see that there was a sigh of relief when the news, when there was the news of, after 1 week, there will be
even the next day.
Yes,
the roads were all filled up.
Just the next day. Now, if the figures have jumped to the Lagos figures are 931, and that's up. Yesterday it was what, 817?
It's 870
something.
800 and something.
It even trended for a while on Twitter.
Yes, exactly.
That 870 something. Now we have 931. How I wish we could say that tomorrow it'll still be 931, and then day after tomorrow it'll still be 931.
Well, the commissioner will tell us. But I know that in the time past, the commissioner has been saying Lagos will be hovering between 70 to 80. Cases, and so we should be thinking about 1,000.
Well,
before this week runs out, we should be thinking about 1,000 plus.
And it's a worrisome number.
Yes, it's worrisome, and that is why we have to step up, the testing capacity, and then people have to also go about making sure that they wash their hands and try and reduce
the
community
testing capacity
transmission.
that you've gotten onto, again, the commissioner will be talking to us about that. Because we are now we're testing more people, we can expect the figures to rise. If I heard it correctly, and if I recall correctly, something we were able to test about 2,000 people, I think, a day now.
Yes, I think they are planning on 2,000 per day, in the next 3 months. In fact, they are saying
Is that Lagos or the whole nation?
The whole nation is even 2 million. That is their target.
So Lagos,
that is, every state should be able to test about 50,000.
Okay.
So that be able to.
So we get a more accurate figure.
Exactly. So by the time they increase the testing capacity, we'll be able to know who has this virus and who does not, and then they'll know who and who to quarantine
and then tracing
do the contact tracing and reduce the transmission. Because as it stands now, the numbers will keep increasing.
They are,
and because
the numbers
people
are
want
quite
to
worrisome.
go out.
It depends on how you look at the numbers, because we're talking about those numbers. I made a few notes here, and Lagos actually, in terms of discharges, because we also need to talk about discharges, Lagos has actually discharged more than the two other states that I cited, Abuja and Lagos, individually.
Yes.
Because Lagos has actually discharged 192, patients, successfully. And why I said what I said, comparing them with Abuja and Kano, was that Abuja has 174 confirmed cases, Kano has 139 confirmed cases. Now, Lagos has actually discharged 192 so far, although the figures for Abuja and Kano are 36, and in the case of Kano, 0.
Lagos has really tried, compared to
but the figures, when
the facility that they have on the ground.
And also when you compare it against the sample of the actual number of people that are what they call lab confirmed cases, it works out. It pans out to roughly the same, because Lagos is dealing with 931 cases, and the deaths, 21, unfortunately.
Yes.
And
then the active case, if you look at the active case, which is about 18, if you do the plus and minus, it's about 200.
Yes.
And thankfully Lagos has the bed capacity to take care of 200.
Yeah.
You understand? So, but that doesn't mean that people should just go out and say, well, Lagos has, they can take care of me and all that and all that. No, people also have to see that this is a serious matter.
It is, and we're going to have to do, there's a lot of it that we're going to have to do for ourselves.
So like from Monday, because I know so many people want to move out on Monday, the face mask has to be a must for everybody.
I hear the Honorable Commissioner for Health in Lagos State, Professor Akin Abayomi, is ready for us now. Good morning, Prof.
Good morning.
Okay, this is better. My name is Yori Folaring. I'm with my colleague here, Asukwo. Thank you very much for joining us. Well, first of all, we're all preparing, I imagine, for the phased relaxation come the 4th of May. Governor Sanwo-Olu has indeed begun to sort of address us on that. We've seen that on social media. But I wanted to bring something up, Prof. The numbers are jumping, and people are worried that the numbers are rising, and yet we find ourselves having to relax. Between yesterday and today, there's been a jump from 800, the high 800s to 931. Prof, are you concerned that as we go along, and by the time we actually now open up, the numbers might go through the roof?
Okay. I think, we are dealing with a highly contagious pathogen that's causing a pandemic. So there's no part of the world that is going to escape this situation. You must look at what's happening in Lagos in context with what's happening around the world. So you talk about figures jumping, but actually, if you compare where Lagos is now at the same time frame from the index case to what's happening in Europe and the United States, they're seeing thousands and thousands of cases per day with, hundreds and hundreds of fatalities. So we have to look at the situation in Lagos in context with what's going on around the world. So going from 70 a day to 80 a day to 90 the following day is not a jump. It's a gradual incline. And if you look at the graphs from Lagos State, we are just operating on what we describe as a flat curve in terms of us identifying patients that have symptoms. Now, if we test randomly in the community, we may find more positives and our figures may be higher. But as you know, the profile of this disease, most patients are asymptomatic or mild and do not necessarily seek medical attention. We generally hear from people who have moderate to severe, and those are the figures that generally we are capturing. Or sometimes we capture contacts of people who are very sick. So
Okay.
we're looking at other data.
Okay.
We're looking at call center activity. We're looking at our active case search.
Okay, Professor Abayomi, I beg your pardon for interrupting you. I just have to go on a quick break now, but I'll be right back. Please stay with us.
Okay.
Okay, we're back and we have Professor Akin Abayomi, Lagos State Commissioner for Health, on Skype with us. Thank you for being with us, Professor. We're back. Okay. Yes.
Okay.
Yes. Indeed. I do take the explanation that you have given. I was indeed limiting myself to Lagos State itself when I spoke, but I appreciate when you say we have to put it in the context of other numbers. I really was asking the question of you as a person on the ground, you know, that knows Lagos, that we will be opening up, no matter how limited and no matter how much in a phased way. We were wondering if the fear is justified that there will be a rise. And I appreciate what you just said, that the curve in Lagos is relatively flat. Will there be a rise that will go beyond what we've been seeing as a result of the management that you and your team have been doing in Lagos because of the increased freedom, shall we say, or exposure?
Okay. So, you know, when you're in a public health crisis, you have to consider other perspectives. So there is an economic and there's a security side of a public health or biosecurity threat. So we have sick people on the one hand, we have a pathogen that's trying to infect as many people as possible. We have a large population of people who depend on their livelihood from day-to-day activity. They don't have the safety nets. You know, malnutrition will set in, civic disobedience will set in. You will start to have other situations developing. So, you know, at the end of the day, you have to find a middle road, somewhere that balances the maximal public health mitigation factors with, you know, general livelihood, sustainability, and security issues. So it's not all about public health right now. It's about life.
Okay. So there will be some trade-offs. We have to expect that, as you just explained. There will be trade-offs.
Yes, that's right.
Prof, just a slight clarification from you. When the figures that are released tell us about lab-confirmed cases, for instance, in Lagos, they say the laboratory confirmed cases, 931 is the latest figure from, you know, the Center for Disease Control. And then active cases, 718. So 931 lab confirmed, 718 active. Could you just explain to us, Prof, what's the difference between lab confirmed and active cases?
Okay, so our lab confirmed out of the thousands of tests we've done, we've confirmed 900 plus. They've been admitted, they've been treated, and a number have been discharged. So we have a discharge now of over 150. So then you subtract the discharged from the patients that are still on the ward, and you arrive at your active case. So those are the people that are still infected. And
Okay.
when you, yeah.
So Lagos has, in fact, according to the Center for Disease Control, 192 discharged cases, and unfortunately,
Correct.
21 deaths. Unfortunately.
Correct.
Asuko, did you have a question?
Okay, so Prof, we want to know, in terms of test capacity, how
Yes.
far and how many tests do you carry out per day in Lagos, or so far?
So we've ramped up our testing capacity considerably across multiple centers. We could do up to 1,000 tests a day, which is a lot for this environment. But testing is contingent on the availability of reagents. There's a global shortage of reagents now. Every country in the world is trying to get their hands on COVID-19 reagents for molecular testing. And so there's a supply and demand principle operating now, and there's a worldwide scarcity. So our limitation now is not in terms of infrastructure or human resources. Our limitation now is in availability and access to the reagents we need to perform the tests. So we have a backlog right now of over 2,000 tests to perform in Lagos from the past week, where we've collected from our decentralized sample collection centers at the local government. But we can't test them because there's a shortage of all the reagents that are required to perform these molecular tests.
Thank you, Prof, for that. How easy is it to get tested in Lagos when you have the symptoms as have been explained to us by the authorities? Because you've just said that we have a backlog there of up to 1,000 cases, 2,000 cases. Does this mean that if a person were to think that they had the condition, he might not be able to access the facility that would be able to tell him one way or the other whether or not he had it?
Okay, that's a very intuitive question, a great question actually, and I'm glad you asked that question. So there are two types of isolation. There's isolation for confirmed cases, and there's isolation for case definition. In other words, you fit the criteria for COVID, but we don't have a laboratory confirmation on you. And that's a different kind of isolation. It's called isolation 1. And those are single rooms. We put you in a single room. We manage you as a suspected COVID case until we are able to get your confirmed test through some laboratory diagnosis. So there is no reason why people who are presenting with the typical features of COVID should not be admitted. We have the space and the access for those types of cases. And you just need to call our number, which we always advertise, 08000 Corona, 08000 Corona, and you will be reached. Someone will reach you immediately and direct you to one of our facilities where we have isolation 1 capacity. And then, of course, when you're in that facility, you will get tested and prioritized. We're still running the tests. I'm just saying that we have a shortage of reagents, and so we're not able to perform as many tests as we would like to perform on a daily basis. But we're trying to resolve that problem.
I was going to say, optimistically, Prof, how long before that problem clears itself up?
Well, these are supply chain issues. We don't make the reagents in Nigeria, which is another problem. We don't make much in this country. So we're always dependent on importation, and that's, I hope, a lesson that we learned from COVID-19, that we need to redirect our approach to more in-country production of simple medical and biomedical supplies. And so we depend on a whole chain of supply processes and procedures from countries that do manufacture these reagents, who are themselves under pressure to supply to different countries around the world. So it's a matter of the networks that you have. It's a matter of the connections you have. And some people are applying black market prices. So we're seeing profiteering, and this is to be discouraged. Under a situation like this, we're very disappointed when suppliers apply the rules of supply and demand. So there's a huge demand, and that pushes the price up, which is also a limiting factor.
Okay. Professor, another point is that it will be not just correct social practice, it will be illegal to appear in public without a face mask when indeed we enter into that phase, if it hasn't actually started already. Now, to be clear, these are not surgical masks as such, but anything is better than nothing, right? Because you see a lot of quote-unquote designer masks. Is it that medical experts are saying that, yeah, go on, just use something, but don't have an exposed face in public?
Okay, so there are two concepts to masks. There is the concept of medical personnel protecting themselves from infection, and they use specialized masks that you probably have heard of as N95 or FFP2 or FFP3. So these are masks that are used by frontline medical staff that are in contact with patients with COVID all the time.
Okay.
For people in public, the idea is that you wear a mask if you're secreting the virus, because most people are asymptomatic or mildly symptomatic. Just by virtue of speaking, you produce an aerosol of droplets, which goes into the air. And if you're wearing a mask, that is
The phones will do that from time to time. They've done it again, Prof. We're working on that. But, I think he has to learn because he's the expert.
Yes.
And he's explained to us that there are specialized masks that, people in the front row and the front line of this war, use. But the fact that, even speaking normally, you probably can't see it now, but I think I understood him to be explaining that there's an aerosol of spray that goes out. And that's, I think he was going to land with, even your Ankara mask will contain that and limit it to you. Because we've explained that's the whole purpose of social distancing. If you have the 6 feet that they want, 2 meters, 6 feet, roughly speaking, it's more than 6 feet actually. So it can't travel before gravity takes over and it drops. It's not airborne, but it will travel in air for a while before gravity takes over and then it drops. But the Prof will probably be the best person to make that assertion. But this is the way experts have been telling us about that thing. And
I think if it comes, if we are able to get him, because so many people are already using Ankara, so we want to know what kind of Ankara, the kind of fabric that we need.
No,
whether it's the cotton or the
okay, he'll talk to us about it.
So because so many, I can see even Akin is even wearing one.
Yeah. Everybody.
We don't know because I heard that even if you wear it, if you try to blow the air through it,
you will be able to.
If it, like, for instance, maybe you put a candle on and all that.
Yes.
If the thing just quenches or whatever,
Yes. But
then it means
that's
that you're in
different.
danger or
Yes,
something. So he has to also,
again,
break it down
when
for
the
us.
prof comes back on. But yes, when the prof comes back on,
But at least
he will. But
bear something.
the mere fact of speaking to each other in public, which people are going to have to do. I take what you said about you could blow a candle out through one.
Immediately.
But we don't expel as much forceful air when we speak, hopefully.
No, but what if you are shouting?
Well. Let's go on another commercial break. Stay with us, please. We'll be right back. Okay, welcome back. And Professor Akin Abayomi, Lagos State Commissioner for Health, is back on connection with us. Prof, thanks for staying with us.
Yes.
Yes, you were explaining just before the sound dropped out, and you were explaining the concepts of masks, and you sorted out, I think, the specialized masks that people on the front line of this war against COVID-19 about. And then you'd gone on and you started to explain about, ordinarily speaking, you have aerosol sprays, and you were going to use that to comment on Ankara or designer masks that are on. And you were responding to my question is anything, just something better than nothing?
Yes. So just to emphasize the point about the medical masks are called respirators. And because it's a droplet-borne infection, the medical personnel are constantly in an environment where there are droplets produced by the patients. And so these airtight masks that are worn are very expensive. They're hard to find, and we're trying to keep them for the frontline workers. Now, for the general public, every time you speak, cough, or sneeze, you produce droplets. If you're wearing an Ankara mask, you then reduce the amount of droplets that you produce into the atmosphere in which you are sitting. So you are actually protecting the people around you. You're not protecting yourself. Mm-hmm. But if other people are wearing it, then they are protecting you. Okay. So the reason why we're wearing masks in public is to protect each other.
Mm-hmm. No,
if you wear an Ankara mask, it's not going to stop you from catching droplet-bound particles that are in the atmosphere, because an Ankara mask is not an airtight mask. All it's doing is protecting or reducing the amount of droplets produced by somebody else. Now, we don't know who is positive and who is negative. Everybody should be assumed positive until proven otherwise. Mm-hmm. And therefore, if you're wearing an Ankara mask, you are reducing the risk of community from getting infected. And so we're trying to trend it, let it become a way of life during this COVID-19 situation. Everybody should be wearing a mask. Let's just reduce the general risk of anybody else in community breathing in droplets that could be captured when you're wearing a mask over your face. Mm-hmm. The other thing is that when you're wearing a mask, it stops you from touching your mouth and your nose. So, we all have a tendency to put our hands into our face. It's just a natural thing.
Yeah.
But if you're wearing a mask and your hands are contaminated with COVID, you try to reach out to your mask. Of course, it gets shielded by the mask. You contaminate the mask and not your face.
Mm. And then the other thing is gloves as well, because experts have explained how surfaces too can harbor the virus for a period of time until it is cleaned or disinfected or whatever.
Yes, so that's why you need to wash your hands frequently. I think walking around with gloves, even if you're wearing gloves and you touch a surface, you're going to contaminate the gloves. So, gloves are not generally for the public. Gloves are for medical personnel. But you should be cleaning your surfaces regularly. You should be washing your hands. Going around spraying chlorine into the air. The virus doesn't live in the air. It lives in the vicinity of people. You can't sanitize the atmosphere. You can only sanitize surfaces, your hands, your immediate environment, and even the air you breathe. You can't sort of spray the air to try and kill the droplets. Otherwise, you need to have a permanent sprayer on your head, disinfecting the air that you breathe. That's not possible. So the best way to deal with this is to wear a mask and to wash your hands frequently and just avoid touching surfaces that have not been sanitized.
Okay, then. Maybe finally, Prof, we said that the figures say, unfortunately, we've lost 21 people in Lagos so far. The matter of burials, first of all, it is the regulation that deceased will not be released to their people to, bury. I'm asking that actually. And then because of this whole situation here, this whole, restriction of movement, the morgues, we understand, have sort of filled up a bit. You talk about burials for relatives and for loved ones in those two cases. One, in the case of the corona disease succumbing to it, and two, the backlog of burials.
Yeah, so Mr. Governor Babajide Sanwo-Olu has addressed this very fairly and squarely. There's no limitation to burials, whether for COVID-19 or otherwise. For COVID-19, we go through a process of decontaminating the body with chlorine solution. It's just a matter of a simple process that's carried out by the morticians. And then the body is placed into a body bag and then placed into a coffin. And then you can carry your loved one and perform a burial ceremony. No limitations whatsoever. Similarly, if you die from something else, there is no limitation on burials. Even though there's been a lockdown, if you're going for a burial, the security agencies are aware of the fact that you're conducting a burial. The only limitation is that there shouldn't be more than 20 people at the burial site, and everybody should be practicing social distancing, and there should be no socializing afterwards. So, in effect, apart from the social distancing laws and guidelines, burials are not to be dragged along. We are encouraging people to come and collect their loved ones and perform the necessary burial rites, no matter what the cause of death.
But I just wanted to be clear about deaths as a result of COVID-19.
You said it has to be decontaminated.
It will be decontaminated by government and then handed over to people, or? Prof? Okay, the audio has gone again. But okay. You can hear us now. I just was wanting to be certain that deaths that result from succumbing to COVID-19 will be decontaminated by government before being handed over to their relatives.
Yes, of course.
Okay, that's the way it goes. Okay.
Yes.
So I just wanted to put in perspective. So it's not a matter of, there was a time the information was carrying about that deaths from COVID-19 cannot be released, to their relatives. But you've just clarified that that's not the case. After due process by government, they can.
Yes, and for public safety, every death now should be ensure that the government knows about it. If you die in community, it should be reported under normal circumstances. But some situations, people are dying and government doesn't get to know about it, and you carry out a private burial. That could be risky, because now any death should be checked, and you look around. If you died from a road traffic accident, well, that's a straightforward thing. But if you died from a fever or from some mysterious disease, then it should be COVID until proven otherwise.
Oh, okay.
So, Prof, I have to ask two questions since it's the final question. The federal government says they are going to test about 2 million Nigerians. How realistic is this? And in terms of contact tracing in Lagos, how far and how many people are you contact tracing so far?
Well, we're still doing, I can't speak for Nigeria because I'm in Lagos. And in Lagos, we've ramped up our testing to between 500 and 1,000 a day. If we carry on at that pace, provided we can get hold of reagents, we will just keep testing as required. But contact tracing is ongoing. If somebody is defined as positive, then we are able to follow the contact tracing and find out people that body has been in close contact with. Usually that's between 30 and 50 persons. Collect their names, and we ask them to self-isolate, and if they develop symptoms, then we test them.
Okay, okay. Prof, let me just sneak in this last one. You've told us about the shortage of reagents. How about ventilators, right? But I hope I'm saying the term rightly. To help people breathe, those machines that help people breathe. Do we have enough of those? Do we have a need for them as of now?
Yes. So, when you get to there are about four clinical stages of COVID. There's asymptomatic, there's mild, there's moderate to severe, and then there's critical. So people in critical state are usually suffering from respiratory failure, and it is at this point that they need some assistance, either in the form of oxygen or high flow oxygen, or something called CPAP, which is a positive pressure air ventilation. And then the final stage is intubation, where we actually ventilate your lungs.
Okay.
Excuse me, I'm coughing now because I've interviewed so many times.
Okay.
Yeah, but we're not seeing so many of these cases. What we're trying to do in Lagos, what we're trying to do in Lagos is to treat you early, to get to know you early, and and to intervene before you require those situations.
Okay, Prof. I think we'll let you go now. So thank you very much for joining with us, and we understand you a dry throat. Thank you very much, Professor Akin Abayomi, Honorable Commissioner for Health in Lagos. If it weren't for the cough, I was going to ask the Prof how close we are. I wanted to hear it from him, a medical expert, how close we are to the the magic bullet, aka the vaccine. What are his thoughts? We've been told that it's at somewhere like 18 months away, but it would have been good to hear a professional's opinion on that whole matter. However, the good prof's throat was getting drier and drier, and we had to let him go. So, okay, now.
The situation with vaccines is that...
Oh, thank you very much, Prof. Continue, please.
Yeah, the situation with vaccines is that, a vaccine is an injectable. Once you inject it into a human being, you can't take it back, usually. So, when you develop a new vaccine, you have to go through several stages of clinical trials and safety profiling, because you could inject a vaccine, and we've seen that in the past. The vaccine is injected, it seems to do the job at the time, but a year or 2 or 3 later, we develop some severe complications as a result of the vaccine. So, vaccines are not things that we joke with, because you have to do lots of animal studies, you have to do a lot of safety profiling, you have to make sure that there are no long-term complications of the vaccine. There's no point preventing COVID infection now, and then 2 or 3 years down the years, you have your children developing all kinds of neurological conditions or retardation or dementia or kidney failure or things like that. So, you've got to be very careful with vaccines, and you just have got to know what you're doing. If you vaccinate 5 million Lagosians and 3 years down the line we've overlooked a complication, then I think we would have not been fair to our population.
Indeed. I want to thank you very much, Professor Akin Abayomi, for coming on this morning on TVC. Thank you very much, Prof.
You're welcome. Bye-bye.
So, there you have it. It's important to note the prof explained that, yep, we're going into this phased, relaxation, but it's going to be a trade-off. Anyway you look, it's going to be a trade-off. And he had explained it. There are economic issues, there are economic issues, there are law and order issues, all of those things, But I guess what what we can take from all of that is that the prof didn't say it. He declines to use the exact phraseology that I used, but the numbers will go up. And we have 931 cases now today. That is, when I say today, it's even more now because NCDC is going to come and give it to us later on in the evening, in the night. But these are figures as of the 29th.
Yes, here, which is last night, I think.
Last night at 11:30 or something like that. So this night at 11:30, we'll get the summarized figures again. And just looking at it, we know it is, the prof was explaining that we have a relatively flat curve in Lagos. But
which is surprising.
Yes, this is surprising. And when you look at those numbers, it's important. Yes, it's important when we say that Lagos has 931 cases, and that Abuja, for instance, has 174, and Kano has 139. It's important to look at, the size, the population size that we're dealing with, and so we'll be relative. Would you like to? Dr. Boyo has come on. Dr. Boyo. Is Dr. Boyo on Skype? And we welcome you, Dr. Boyo, on Skype. Good morning, Dr. Boyo.
Hi, good morning, Mr. Yori.
Good morning, sir. Good morning, Dr. Madili Boyo. I'm waiting to see your picture. Aha, now I'm happy. I've seen your picture. Aha. Well, you heard the Minister of Health in Lagos State just now. And especially what would be everybody's joy now would be to have a vaccine, but then the prof explained that that is not a jocular matter at all. That there's no way, you make haste very, very slowly with vaccines. Would you like to comment a bit on that?
Yes, thank you very much. The commissioner was correct. Apart from the fact that we don't have a vaccine yet, there have been trials going on, and none has been successful to the point of being reported in peer-reviewed journals. So for now, there are no vaccines. But to get a vaccine, people are predicting about 2 years from now before a vaccine can be gotten, even in advanced countries, before the vaccines can be approved, then commercialized for use. So for now, they are not. But it's also correct in a way that you don't just use vaccines for the purpose of using them. These vaccines are very, very sensitive, and they can lead to many critical illnesses if not properly, if we're not properly proven to be effective before being dished out. Thank you.
Neither do we have, it's not just vaccines we don't have, neither do we know of any medicinal cure today. What we are doing is managing the cases as they come along. Is that correct?
Yes, there are no, we are attempting to use some drugs. There are some drugs being used, but no cure in the sense that there's no single proven drug that can be said to be 100% efficacious. So what we are using now is mainly taking care of, like you said, if you listen to it very well, the various stages from asymptomatic to symptomatic to mild, moderate, severe, critical. So what we are doing now is that we treat coexisting issues like respiratory failure and severe respiratory infections and things like that, temperature. But to say that there's a magic drug, that you just take it and it is gone, we are not yet there.
So in effect, your the patient, his or her own immunity system is doing a lot of the work.
Come again?
I said, from what you've just said, I am deducing, and please tell me if I'm correct, your own immunity system is doing a lot of the work of healing you, of fighting off the virus.
Oh, yes. Because it's a virus, we have a God-given immunity system that is inbuilt, that our bodies just sense the virus is in, and we develop antibodies. These antibodies are now developed to fight the virus. So it depends on the state of immunity that you have. Now, listen, if you've had coexisting challenges like heart failure, like kidney failure, or even diabetes, your level of immunity will drop. So your ability to fight the disease is also compromised. That's why the elderly and people with pre-existing conditions or comorbidities find it difficult to face the challenge of this illness.
Okay, stay with us, Dr. Boyo. Mr. George has called in from Ikeja. Good morning, Mr. George.
Good morning, Uncle Yori.
Thank you for calling in, sir. Good morning.
Uncle Yori, I'm calling to thank the Lagos State government for their efforts on this pandemic. I wish the commissioner were still on the line.
He probably is still listening.
Okay, now, I've been watching the figures. The rate of recovery in Lagos is very high, judging from the number of people they discharge every day. That's a good one. But we all know that there hasn't been any vaccine for this virus. What are they using that makes them to get those people out of the woods? I would have loved the commissioner to tell us what is the secret so that other states might emulate them.
Okay, Mr. George, and indeed, thank you for the call. But this is a point that Dr. Boyo was actually on at the moment because, first of all, we've established that there is no medical cure. There is no bullet. There is no tablet. So what the doctors are doing, we understand, is that they're managing all the symptoms while your immunity system, as Dr. Boyo was explaining, is really doing its best to fight it off. And that's why, as Dr. Boyo has just finished saying, if you have a compromised immunity system, then you have a weaker arsenal with which to fight. And that's where the whole matter about the aged, the middle-aged, or the children comes in. But I'll let Dr. Boyo, relate to the question. Will you, please? Dr. Boyo, did you hear Mr. George and
yes, I'm here.
my attempt?
Yes, I heard the question. I heard the question. The fact that there are many drugs on trial, and the medical community is very, very careful in releasing names of drugs they are using on them, because one, people could just go and rush and begin to buy them, because apart from the drug being used, there are other issues being taken into consideration. The environment itself. You don't treat such a disease in a private hospital or at home. Is something that is treated in a very secluded environment with a negative pressure, so that even if we're going to give the drug themselves are completely covered with PPEs, and they're going to give these tablets, and they're going to, so it's not just drug. You take temperature, you monitor SPO, the mental level of oxygen saturation, and you want to ensure that the patient is doing well. So sometimes you find out that you are treating respiratory infections, you are treating bacterial infections, and there are some antiviral drugs that I believe that are being used right now by the NCDC, but those are left for doctors to look at. So they are not issues that are open for everybody to just look at. So what we are having now is that these cases are very clear cases in which doctors have been very careful about what they can use. Okay. So they are trying to make sure that they use things that they can really be very sure about. And so by the time you release a drug now, like when Donald Trump said hydroxychloroquine, the price of chloroquine went up significantly everywhere. Okay. So that's what we have to say about it.
I have a caller in from Cotonou. I beg your pardon, Dr. Boyo. Sorry to interrupt you, Dr. Boyo. A caller has come in from Cotonou. Good morning, sir.
Good morning, Mr. Yori.
Good morning, Eugene. Good morning.
Good morning, Uncle Yori.
Good morning, sir.
Good morning, Uncle Yori. How are you?
Very well, Akin. Good morning, sir.
Good morning, Uncle Yori.
Good morning. Yeah. Good morning.
Yeah, I want to greet you for the good work you are doing.
Thank you very much, sir. Thank you.
Yes. And I want to suggest with the
we'll fix the spelling of your name shortly.
Case we are getting now, with the positive case we are getting now, every day it's increasing. I thought that we were supposed not to have. Are you hearing me?
Yes, I was just saying that we're going to fix the spelling of your name shortly. We'll replace the I with an E. Please continue.
Okay. I say I want to greet you for the good work we are doing.
Thank you, sir.
Then, yeah. I want to suggest that with the system of positive cases we are getting every day, the thing is increasing every day. There, and people are talking of economy. Is who is living that will talk of economy? I would have suggest that the lockdown should supposed to continue throughout the whole country for now, because the thing is not going down; it's going up every day. That is my suggestion. I said that as this, our president is supposed to increase the lockdown throughout the whole country for now. Because the thing is increasing every day, and we are talking of economy.
I know,
you know when we are alive that we talk of economy.
I hear you. Thank you very much for calling
that
in.
Is my question. Thank you.
Thank you very much. We're caught between a rock and a hard place. Exactly. The professor touched on it. Between a rock and a hard place. I don't want to use the other similar one. There are challenges. There are challenges. Dr. Boyo, thank you for staying with us. Relating to Eugene's observation, Professor Abayomi also touched on the matter. We're just simply caught between a rock and a hard place. There are so many factors. Even as, Eugene said that, look, it is only the living that can address the economy. But there are going to be trade-offs because people simply are tired, have got, what is it, something fatigue. They become fatigued. Lockdown fatigue. So government has, quote unquote, compromised, if that is the word, so that there won't be a breakdown of everything. I have just 10 seconds, I understand, so just go ahead, sir, for about 10, 15 seconds. There's no way out of this. It's a quagmire. We have to do this and take the price. Okay, thank you very much, Dr. Boyo. I could see that there were challenges. Eugene's comment was noted. We're just going to have to do this, and it's implied. We're going to have to take the cost.
We locked down before.
Yes.
And then the number of testing, didn't really, was not really appreciable, if I'm to use that term. But from what Lagos is doing, I know that they are really doing well.
We've got to go now because we understand we must go on this commercial break. But thank you very much to Dr. Professor Abayomi and Dr. Boyo. And also to you for joining us. Please join us tomorrow for a fresh edition. On behalf of Asukwa James, I'm Yori Folarin saying bye for now.